Prime Minister Modi this morning leading the second phase of India's vaccine drive from the front. At 7 a.m. this morning, the Prime Minister was administered with the first dose of India's indigenous vaccine, CoVaccin. Taking to Twitter, the Prime Minister said he took his first dose at Delhi's AIIMS. He also has lauded the doctors and scientists of the country and said they have worked in quick time to strengthen the global fight against COVID-19. He's also appealed to those eligible to get vaccinated. Sister P. Nivada from Puducherry administered CoVaccin to the Prime Minister. CoVaccin is developed by Hyderabad-based vaccine manufacturer Bharat Biotech International Limited, and its Phase 3 trials are currently underway. It is one of the 2 vaccines that are being given in the country right now under restricted use. The Prime Minister is seen wearing a gamcha of Assam, which is symbolic of blessings of women from Assam. He's been seen wearing it on many other occasions. Milan Sharma is getting us more details on that. Milan, great deal of hesitancy when it comes to the vaccine. In a country like ours, unfortunately, that traditionally has been vaccinating against so many infections, particularly vaccine. There's been a lot of concern about CoVaccin, and the Prime Minister, with this one decision, with this one move, had tried to address all of those problems, isn't it?
Well, that's the message that has gone out as the Prime Minister this morning took the first jab of Bharat Biotech's indigenously made CoVaccine. And that is the message that will resonate in the people as well. Well, they begin taking the vaccine today after 12 o'clock. At 9, we are expecting the app CoWin to allow user registrations for people across the country. This is for the 60-plus population and the 45-plus population with comorbidities. But clearly, in the morning, as the Prime Minister took the first shot of CoVaccine, that quells hesitation against the vaccine, despite the fact that its Phase 3 trials, interim data as well as the full efficacy data is still awaited from the company's side. But the Prime Minister there clearly sending out a message. There's nothing to worry about when it comes to the COVID vaccines that have been created in the country as well. And whether or not it's Covishield or CoVaccine, both vaccines are equally safe and efficacious, which is why the Prime Minister has taken the first shot as the leader of the country so that others can also believe in the vaccines and go ahead and take the first shot today, especially for those who have remained the vulnerable category throughout the coronavirus pandemic at this point, which is those above 60 years and those above the 45 years with comorbidities. And certainly, the PM had said when it is his turn and when it is the turn of the ministers, they should come forward and take the vaccine and not cut corners until such time that the healthcare workers in the country and the frontline workers are vaccinated. There is enough time there. This is Dr. Guleria, who is right now inside AIIMS, and he is moving towards his office. He was in charge of looking at the vaccination process of the Prime Minister, and therefore everything that has gone out smoothly. We've also been told that the Prime Minister took the vaccine at AIIMS in the morning, and he did not take any particular route that was put in place for the head of state. He came normally and took the vaccine in the morning so as not to inconvenience the people within the hospital as well. So that has essentially set the tone of how the day will progress.
Also, the other message from the Prime Minister this morning, Milan, that I waited for my turn, because right in the beginning of the vaccination drive on the 16th of January early this year, the opposition said, why should the Prime Minister not take it? Why should the other ministers not take it? And the Prime Minister sent out that message that I have not jumped the queue and nor will my ministers, isn't it?
Definitely, Sneha, and this is why the Prime Minister was the first one to take the vaccine today as the head of state, because there has been a lot of opposition talk regarding the efficacy of CoVaccine. We know that certain states like the state of Chhattisgarh had also said that they will not administer CoVaccine at all, citing a lack of data and lack of efficacy data. But largely, the Prime Minister has been completely optimistic quick at this point, and he has said that all ministers must also come forward to send out a positive message. We know in a country like India and also countries abroad, there is a large amount of vaccine hesitancy which can come in the way of inoculating the population of countries. But in India, so to say, we have been able to inoculate sufficient amount of healthcare workers as well, which are 1 crore roughly in number. We're already doing the frontline workers, and we've crossed a threshold of vaccinations in the country as well, although not as much as those countries that are vaccinating abroad, but we have done a sufficient number. This
Yes,
is the time for the vulnerable population to take the vaccine. So all the ministers now, whether be it the cabinet ministers in the union government as well as ministers of the state, will come forward. Very importantly, Sneha, I'd like to tell you that the ministers have been asked to pay for the vaccine. So most likely they would be going to the private facilities. Vaccines are free for people in government, but
Yes.
will be paid by the people for rupees 250 per
Yes.
shot in private hospitals.
The vulnerable people in the country, unfortunately, those who've been succumbing to the infection and developing a severe form of the disease will start to get the shot from today onwards. It's a huge development. Milan, continue to be with us. India is all set to begin its second phase of vaccination drive. It was supposed to start at 9 a.m. and registrations will be in fact starting. It's expected to be a little slow is what has been indicated. However, in this phase, people above the age of 60 are the senior citizens who have been developing severe infection, and those with underlying healthcare conditions above the age of 45 will be vaccinated. It's 27 crore people in the country. It is the priority group. The Health Ministry has asked the private hospitals to sell doses at the cost of rupees 250, which is 150 for the one dose and 100 rupees is the cost for administering the vaccine. The ministry has included 10,000 private hospitals listed under Ayushman Bharat or the PMJ scheme and 600 hospitals under the CGHS for the second vaccination drive. While the government hospitals will administer the vaccines free of cost, under this phase, the government has planned to vaccinate as many as 27 crore people. Those who will be vaccinated will get a QR coded certificate and will have to carry their government ID to get the jab. Meanwhile, Bihar Chief Minister Nitish Kumar is also expected to take a shot at 1 p.m. this afternoon in Patna. Mustafa Sheikh tracking that story from Reliance Hospital in Mumbai. Prema Rajaram from Amri Hospital in Kolkata. Milan, of course, continues to be with us from Delhi's AIIMS, where the Prime Minister just 2 hours ago took his shot against COVID-19. Coming to you, Mustafa, now. Give us an idea about how Reliance Hospital is preparing for walk-in vaccinations, since the government has said that this time around in the second phase, that is something that must be allowed.
Yes, all the private hospitals in Mumbai are gearing up for the vaccination because there are preparations which have to be done, for example, cold storage facilities, and the portal has just been started and at 9 a.m. senior citizens will be downloading the app and then registering. So the BMC has said that as of now there will be 3 private hospitals in Mumbai, and the rest of the public vaccination centers which are already available will also be available for the senior citizens. As soon as the dry runs take place and everything is going efficiently, these number of private hospitals will be increased. As of now, the BMC in Mumbai is focusing on smooth functioning of CoWin app. They are advising citizens not to rush and register themselves, which leads to some software getting hanged. But they are saying that phase-wise, let's slowly first work out the details with the CoWin application. If the registrations are successfully being accepted, the vaccination centers will be increased so that more and more senior citizens can get vaccinated in Mumbai at private hospitals. Back to you.
All right. Be with us, Mustafa. We'll just come back to you for more. Prema is also with us. Prema, take us to the kind of arrangements that have been made in Kolkata city, because a series of hospitals within the state government will be giving this for free, given the fact that West Bengal has yet not taken up the Ayushman Bharat scheme, isn't it?
Well, Sneha, over here there are 15 government hospitals and 10 private hospitals which will be there for citizens to walk in and take the vaccine. There is, of course, this concern about what the cost of the vaccine is going to be, because private hospitals have told us that they're still trying to see what kind of fee they are going to be charging for the vaccine. Milan did mention 250 rupees per shot, but private hospitals over here in Calcutta are still trying to find out what is the amount that they're going to be charging. Apart from that, Sneha, The 10 private hospitals in the city are gearing up. After 12 in the afternoon, there are going to be people who are going to be able to register on the CoWin app. There's about 50 people each hospital is going to be vaccinating against COVID-19. Out of this, 30 people above the age of 60 are going to be vaccinated, and about 20 people from the age of 45 to 59 years of age. As far as the facilities are concerned, this hospital, AMRI hospital, has both the Covishield and the Covaxin. So anybody who wants to take either of the vaccines can do so. Of course, there are concerns about which vaccine will be more efficient, and some people with comorbidities are wondering whether they should be taking the shot at all. But they are consulting their doctors, and the doctors are in fact telling patients with comorbidities that they must take the vaccine. So a lot of people expected to walk in, but to prevent the rush, hospitals are encouraging people to first register on the app and then walk in, so that there can be a seamless experience as far as the vaccine drive is concerned. Back to you, Sneha.
Yes, be with us, Prema. Milind also continues to be with us. Milind, there have been concerns. The government has already indicated that there will be a problem of speed of internet, of overloading as far as the portal is concerned, because a lot of people will try and register, isn't it? What are you picking up, or are you seeing any of it just yet?
Well, Sneha, I'm at the registration online website of the CoWin app. We are trying right now to register on the app. I have put in my number, which is when you will get the OTP. But currently, it seems like the app is slow. It's past 9, so we are down by 15 minutes after 9. And that is the link. So just now, I have received the OTP on my number. If my camera person could show you, I will now enter the OTP in my phone, and I will continue to register. So the link that I am using here, if my camera person can show you, is selfregistration.cowin.gov.in. So that is the app link that should be used for the registration. My OTP has come by SMS. I have some seconds to input my OTP, and I will be doing that right now to verify. So first of all, you need to input your mobile number on the link, and after that you will receive an SMS of the OTP, and after that you must enter the OTP to verify your status on the app. On the top here, Sneha, you see there's a button called register. So once you are ready to register and log in, you click on the button and then you input your number. Then the OTP will be sent to you for registration. So this process has started now, so we can say that the registrations have begun on the app, Sneha.
All right, registrations have begun on the app, on the CoWin portal is what Milind is telling us, and that's the big story that we're getting at this hour. It was supposed to start at 9. It's been delayed only by a couple of minutes, but glitches like these were expected, is what has been indicated even by the developers of the app. But the registration process has started, so you can log on to cowin.gov.in and try to register if you are eligible to get the shot. The other way of doing it is through the Arogya Setu app. Milind, we'll talk about that also in a bit from now. Be with us. Aishwarya Paliwal is with us also from Delhi's Max Hospital in the Saket area of South Delhi. Aishwarya, just tell us, how is the hospital preparing to take in walk-in vaccinations, and what about the people who registered and come to the hospital? Are you getting to see any people there?
Well, there are some people who are waiting. I'll ask Wakar to show you. These are mostly people who are 60 plus. Now, they are still waiting for the vaccination drive to begin here at the Max Hospital. There are various counters which have been put up. For all those people who have already registered on the CoWin app, they can just come here, show their registration, and then the vaccination drive will begin. They have 5 vaccination centers solely dedicated to those who come for the vaccination drive. From here, here is where the people will get themselves registered, and then they will walk in inside. We are not allowed to go in at the moment, but we will be allowed shortly. This is the place where people will go in, and once they get vaccinated, they have a special dedicated waiting area too. For 30 minutes, this is where the observation will be done. Everyone who gets the vaccination will be made to sit for 30 minutes and observation will happen. And once the doctor gives the green signal, will these people be allowed to go out. 250 rupees is what they will have to pay per dose for both the vaccines. You have whichever vaccine you get, Max Hospital at the moment is charging 250 rupees. They are still waiting for more people to come in. Once this area is entirely filled is when the vaccination drive will begin inside the Max Hospitals. Sneha.
All right. Be with us, Aishwarya. In fact, the government, of course, has roped in private hospitals to help vaccinate those above the age of 60 and those also above 45 years of age with specified comorbidities. But how much would you need to pay if you choose to get vaccinated at a private hospital? Remember, the choice is yours, private or government, but you can't choose the vaccine. You certainly can choose the site. Here are the details.
The second round of the world's largest vaccination drive. And in queue are those above 60 years of age and those above 45 years with specified comorbidities.
All arrangements are laid down by the government of India and government of Delhi. They are in place and the same will continue. It is only that under new policy, apart from now we are going to charge the rate whatever government will say, and we have to yet to know how do we procure vaccine, whether the government is going to supply or whether somebody else is going to supply.
Union Health Ministry has fixed the vaccine price at rupees 250 per dose for private hospitals, confirming India Today's exclusive scoop. The price ceiling has been set at rupees 250 per person per dose, which includes 100 rupees service charge. The total cost for 2 shots of the vaccine would then come to around 500 rupees. Vaccines in government hospitals will be available free of cost. In the second phase of the vaccination drive, the government has simplified the system of certifying people with comorbidities within the age group of 45 to 59 years. A single page certificate to be issued by any registered medical practitioner for the vaccine beneficiaries. The certificate can either be uploaded on the CoWin 2.0 by the beneficiary while self-registering, or a hard copy can be carried by the beneficiary to the COVID vaccination center. Besides personal details, the beneficiary needs to tick the options if he or she is suffering from heart ailments, diabetes or even cancer. Around 10,000 hospitals under Ayushman Bharat and 687 hospitals under the central government health scheme can be used by states as COVID vaccination centers. States have also been given the freedom to use all private hospitals impaneled under state government health insurance schemes as vaccination centers. States can also use health facilities of all PSUs and all government health facilities. The hospitals must also maintain basic cold chain storage points, have their own team of vaccinators, and maintain the facility to manage any adverse event post-vaccination.
With more than 24,000 locations of private hospitals that are empaneled under the Ayushman Bharat scheme as well as the central government's health scheme, the private hospitals are ready to vaccinate more than 60 years of population as well as those above 45 years, giving a much needed impetus to India's largest vaccination drive. With Sanjeev, this is Milan Sharma for India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.